conversational way. So if you want to be involved in this panel discussion, raise your hand. Mr. Amir will put you into the chat, into the session, and then we can all have a conversation together. Thanks for coming back, Z. Here's Letitia. Thought we'd see her. Z, I want to introduce you to Evan Thompkins. Evan, Z Okoranto, who's now with the Yarrow Collective. Wanted you guys to meet.
Hey, good to meet you.
Hi, nice to meet you. I'm in Denver, the Denver metro too, which yeah, I was Jason sent me the link to your guys' org, I think last week or something. So it's looking at the work y'all doing. So seems great.
It's really exciting.
Yeah, the whole website's getting redone, so
You're not going to get rid of the purple, are you?
no, they actually rebranded before I came on. Just
We're all about
new
the purple
fancy.
here at AMSA. Well, I'd invite folks just to speak to each other and speak about the conference, things you've seen and learned so far today. What have you experienced? What are you wrestling with? What have you heard that you want to carry back to your community? Anyone want to kick us off? Letitia.
All right. So I think one of the biggest takeaways I've gotten so far is so I live in Klamath Falls, Oregon. It's rural. We have a lot of homeless people. I'll have 10 years clean and sober this year. I have my CADC as well as my peer support. But I've dealt with child welfare. I've been incarcerated. We have a disconnect in Klamath Falls as far as we have one mobile crisis team that's through Klamath Basin Behavioral Health, and they're overworked, right? And so, like, there's a disconnect between law enforcement. Law enforcement shows up to all of the calls that should be mental health, crisis calls. I think what I have kind of taken away is that really on a legislative level where our change is going to have to take place to bridge that gap with law enforcement and peer support, I think. I don't know. So I just appreciate kind of learning that we can do that. It's not so much a question as a statement and an appreciation.
Well, I have been to Klamath Falls, and it is the end of the world. So I'm not surprised, but boy, stick in there. Just especially in the rural communities, it's going to be very difficult to make this transition.
Yeah, and I mean, I think at the legislative level, there's a lot of work to be done, but I think it can start within your community too, like going to city council and speaking about the things you've heard and seen and asking for the appropriate resources. I think we need to push at local levels for our government to kind of step up and do the right thing. Or working directly, is challenging working directly with the police department or seeing if you can get a chief to talk with you and get them to, update their policies and procedures so that they start working with their officers to, when it's a mental health call, like how can we utilize the resources that we have, and, not show up to those things. So, I think there's a lot of opportunities, at the kind of the local level too, but I think it takes community and it takes the people who care and who step up and keep showing up to community and keep trying to talk with the officers and not go away and be a pest until we get what is needed, and what we want.
Other comments in response to Letitia? Shireen, you have your hand up. Do you have a question or thought?
I have a thought, and I apologize. I have another meeting that I need to get to. But I'm being I'm being tasked with bringing together community and redesigning mobile crisis for one of the largest cities, the second largest city in our state. And they want to design it gratefully to be completely peer run. And one of the challenges that I have in all of this is, well, I've been involved in peer crisis alternatives for a long time, mobile warm lines and peer respites and things like that. It feels like peer-led mobile teams are so new and evolving, and mobile crisis itself is evolving, right? So I've heard several things like we're working on a certification and we're working on this report, and we are simultaneously evolving while the policy and our systems are devolving. And so I'm trying to figure out with all of it how to take what I know to be true, what our community knows to be true, utilize our own wisdom, be a part of designing something that maybe doesn't exist, or maybe it is something that exists and needs to be replicated. We don't know what we don't know. But I'm struggling to figure out, there's so many things that are in process right now. And what are the things we can go back to that are, provide us some guidance on where to go with an entire system overhaul with mobile teams.
You want a vision, you want a plan.
Yeah, I mean, I think the vision is rooted in values, which is fabulous. It's translating the values into action. And how do you sit in that tension between complete zero non-police response, not even necessarily clinical response is where we're at. And if there is going to be clinical response, it has to be done through a core set of belief systems and a worldview. And so as Z said earlier, non-carceral clinical support, that in and of itself is considered radical. That's not an easy find. And then you add on that it's completely peer-led. You add on the funding issues, the policy push right now toward AOT and carceral systems. And here we are in the middle of this process with a lot of local will to do something different, but not a lot of information and data about what that looks like.
Well, I think that's very important that we've set some goals here, some aspirations, but how do we get there? And how do we see that path from where Letitia is in Klamath Falls, my God, to some level of a non-carceral response? Because all they've had for 100 years there is the sheriff coming out and sorting things out. So is that what you're looking for? Is this pathway? Because it seems like those pathways are all extremely provincial. They're very local. They're sort of looking at what the strengths you have and what is the next step for. And you're in North Carolina, right?
Mm-hmm.
So
Yeah.
what strengths from where you are at this moment? North Carolina is actually ahead of a lot of states.
I know
It's
in
surprising to
many
you.
ways, in many ways, we have really pushed forward. But it's taken, I've been doing this for 20 years in our state, and it's taken all of 20 years.
You've got a good team in Raleigh. You've got a good team in Durham, team in Charlotte, I think.
Yeah, I mean, it sounds like you're going to be a trailblazer, which I think is exciting, but yeah, it's scary because, there hasn't been peer-led, peer-driven teams all the way through. So you're going to go through growing pains. You're going to have to figure things out as they happen, which in some sense is exciting, but it can also be terrifying. But yeah, as you're kind of saying, I think starting with really defining what your values are, finding that core, what is our value set, writing those out, and then what does that actually mean in practice? How do we translate this value of authenticity or no least harm reductionist approach? How do we translate that into how the work
Yes.
is being done? So I think starting there and getting that concrete, and then a vision and a mission statement can definitely be important, but not being afraid to fail, and to push forward. You're first, but if you do this, people are going to follow. And so, definitely keeping community center and in this as you go forward too, and bringing in, the folks in your community and around you to kind of support and help the growth and help, show the pathway and push in a way that works best for everyone there.
Thank you for that. I appreciate that support. If we even look at one issue of accessibility, how many people will not call 911? How many people will not call 988? How do you create something that is accessible to an entire community where there is trust? And one issue around this is so complicated and it gets difficult to figure out. So I appreciate everybody that's been a part of this. I appreciate everybody that's in it. I'm going to try to make my way to Chicago. So hopefully I'll see some of you there in person.
We'll see you in Chicago. Thank you, Shireen.
Thank you, everybody.
Robert Parrish has got a question in the Q&A. Robert, do you want to come in and ask your question? Robert is, I think, formerly with the Cahoots program, a long time man on the van. Well, we'll see if Robert comes in. Other responses to today's conversation?
Space audio now unmuted. Post attendee Zoom Microsoft.
Jeff has a question. Jeff, if you could mute that background sound.
Yeah, sorry, that's my voiceover thing from my computer reading it to me. Yeah, I was wondering,
And now lower.
oh, sorry, the thing won't stop talking on me. Anyway, they, earlier, what's her name? Z, or what the name? Z, I believe, was talking earlier about not reporting, to when someone, is maybe having problems with suicide, wanting to attempt suicide, not contacting the police and reporting it. And I've taken some. It's what there was all both youth suicide prevention and adult suicide prevention here, and one of the things that they have is they want you to report it. And so, because it's also I'm a mandated reporter. How do I get around that?
Remember that joined the meeting. Beethoven.
It's a great question. Anyone want to tackle mandated reporting?
It's really important to understand the difference between policy, law, and social will. Most people don't know that legally mandated reporting actually does not cover suicide and does not cover even threat to others. That's under duty to warn. So under the actual scope of the law, mandated reporting only covers abuse and neglect of children and vulnerable adults, and it's a legal stretch to hold people. The second part is, I guess, looking at who your certification is through. So, for example, Wisconsin, where I came from, the peer support certification is issued by Department of Health Services. However, it is not issued through the Department of Safety and Professional Services because we are not offering a clinical service, therefore not clinically liable. So there's a difference between, I guess, how you can get around that is advocating. There's a difference between what is legally enforceable, what is organizationally enforceable, and then what is socially expected. And people are told they're a mandated reporter, but there's a hell of a lot of misinformation about that. And I'm actually doing a study with someone from a university called, their name is Riley Drake, and I will share later the link, but we're actually studying mandated reporters in the state of Wisconsin, trying to understand exactly how this misunderstanding happens. So it's a combination of like training, misuses of language, and then also just employers wielding inappropriate control. The way you get around it is lying sometimes, or deciding what you think is relevant. And I have firsthand experience doing some of that when, these questions are largely subjective. So you can also, explain your way out of certain responses. Like, Did the person say they had a desire to die? And you could say, no, the person said they didn't want to be here anymore. That doesn't mean that. How do I know that's what that meant? Because a lot of inappropriate reporting is done by largely a level of miscalculated inference, and sometimes just an overt projection by the provider themselves.
Because if someone's sitting there with the gun in their lap, I'd have a hard time not calling somebody.
Has that ever happened to you?
Not yet. Hopefully it won't,
Won't know till you get there, I guess.
Right. Yeah, and like I said, it depends on all the different situations because they all have, everything's different.
I think it's really hard to sort of control the impulse to play the what if game and sort of
Right.
stay right where you are rather than going somewhere else. And this is something, this is a trick that police will do to discombobulate mobile crisis workers, playing the what if game and just don't panic, be in place, be empathic. You can only do what you can do. And if you're in a situation where someone has a gun in their hand, you're probably in the wrong room.
Yeah. Also, I think maybe, yeah, like you said, well, I think maybe the best thing I could do is stay there with them and just be their friend, and try to talk them down.
Or say, when you can put that gun away, I can come back and talk to you.
Right. Yeah, good point.
Because I'm scared that you're going to get me killed too.
Yeah, there's a lot of overthinking that people do in crisis situations, and I just bring it back to being a kid at the skate park who hung out with other kids that did drugs. I have been around many people spinning pistols at tables, and my question is, what you gonna do with that? Um, and I think that's where it's the right kind of lived experience. Um, I was going to respond to Shireen earlier, but I was getting a little annoyed actually when I hear about people like needing to systematize and how do we translate it. And sometimes the answer is actually that we're not the ones to do that work because there are communities who are already surviving without use of police. There are entire societies and cultural histories that have never relied on police. My stepfather's indigenous, my father's Nigerian. The police is not an option. And we absolutely have crises in our communities. So sometimes it's just not us to do it, even if we're asked. Sometimes it's actually, let me get the grant and let me contract with someone who's already doing the work, who doesn't need to figure it all out and get paid to do it. And then, yeah, I mean, with the question too around like, how do we translate this? How do we translate this? It's like we were all surviving at one point in crisis. And unless you've benefited from police contact, we already know how to do this. You just take care of the people you love. You make really hard decisions. Everyone makes choices, and we're all responsible for the impact that we create. And it's just that simple. Don't need this like big formula and to develop trainings and to certify everyone and get them put on this career laddership BS of like you need to reach this level of
Remember to left the
practitioner.
meeting.
There's just a lot of professionalization actually is sometimes it's at the expense of the community because we spend more time funding people conducting needs assessments and building trainings and training people that aren't equipped to do the job than just paying the people that are already doing the work that know how to survive without calling the cops. It's a little
That's
bit of my a little bit of my anger as a Black American coming through there.
Well, and maybe your most radical statement today is against professionalization and certification.
Received the
I
question.
mean, we see what's happening to the peer support workforce. We see
Yeah.
what's happening to harm reductionists.
Yeah.
I mean, that's like, I mean, certification is the root of co-optation. Do you really need a certification to do non-carceral crisis work? Because then who can get certified? Whose background will actually pass the check?
Received the question.
What does your liability insurance say about employing certain people of different backgrounds? Who has a working driver's license? There's so many other things that actually just like dismantle the
Received
thing
the
you're trying to create by making people fit into a criteria of what it means to be a worker. And the best crisis work is done in jail, in the street, in the homeless shelter, and in the psych hospital.
I think most states still require for peer support specialists that they check the box. Wipes out a whole classification of people with lived experience of imprisonment. Cynthia, I thought I saw
Oregon.
you raise your hand. I'm sure you have a point.
Actually, it's pretty much been said already, but I really appreciate what Zita said. That was very beautifully stated, and I agree that when it comes to crisis work, we're really doing the basics. Like, you're just being present, and sometimes we really overcomplicate things. And not that necessarily we don't want to professionalize it. I am all for peers want to be certified. Great, I am a huge advocate, but I think that when it comes to the work itself and the what ifs and the, like, we can make it overcomplicated. And really, what we need to do is on a very basic human level, be present and be have the time and put the space there for people.
Thanks, Cynthia. Robert's in the room now. Robert, you want to come and ask or make your point? There he is.
Just to echo that, Zay, I think that was like really well said. I think there is this push to try to say that everybody needs a certification and everybody needs to have this thing. And it's like, who is that actually serving? You know, I mean, we make people to cut someone's hair have 300 hours of certification. Like, I don't want a bad haircut, but I don't know that that's really necessary. And we look at like what kind of certification is required for police and other public safety to be able to go out there with lethal force. And you're like, does that actually scale to the amount of training and certification that we're requesting in other places? You know, I think there's a big discrepancy there about like how much we demand in certain places versus others. I would say my point from earlier is sort of on a similar line of like, we as peer support, as mobile crisis response, like I think we need to push a little bit more into these public spaces, because I think right now the police and the fire department are taking these calls, right? They're the ones doing these calls right now, and they are also the ones who are taking the budget to do these calls, right? At the same time, like studies have found that even in big cities, they're like 40% of the calls that they go on, they don't write a ticket, they don't arrest anybody, they don't perform any public safety action. And so do we really need them on all of these calls? I think the answer is no. There's sometimes like if somebody is assaulting me, if someone is taking my property right now, I probably do need an officer or you know, something equivalent. But there's a lot of calls that they go on that do not involve that level of need. And I think we need to push back on the idea that it's unsafe for community responders to go into the community. I think that is that narrative is maybe part of their mindset, maybe part of the public safety mindset, but I think it is faulty in a lot of ways. In which like the police say like, oh well, we can't send a responder out to this part of town. You're like, man, there are already people in that part of town. Like, what about them? Like, they're at the grocery store, they're at the corner, they're at the wherever. Like, we need to push back on saying like that narrative serves a certain message and not necessarily the truth.
Thank you, Robert. Nice to see you. Comments in response to Robert? Evan?
Yeah, no, I definitely agree with that. That, you know, there's a lot of policing is based in kind of that fear of what if, and it's just, you know, people have been doing this work forever. I think one of the things we have to change at large in society is that we're missing a sense of community, and we have gone away from accountability as people. People in middle America, they want the police because they just want someone to call to deal with something that they don't want to deal with. And it could just be something simple like a noise complaint, or, you know, police are getting called for so many things that aren't police necessities. But so we need to kind of, you know, change the mindset and change the understanding of that, having this kind of like lack of accountability of what I can do, you know, to just call the police instead. And I think a lot of people really want the police, and there's always this push of like safety, safety, safety. And it's really of, I don't want to have to take accountability for my community. And I think we need to find ways to show people that we're all accountable for the things and the people around us. And, you know, the police, they're not going to do anything, you know, they're not going to solve the issues. And a lot of times they're just going to create a lot more harm.
Well, we heard earlier that one of the goals that mobile crisis workers should carry around is that they be resource system navigators. And sometimes police do that. Most of the time, they have one solution, which is jail. We're either taking you to jail, it's binary. We are taking you to jail, or we're not taking you to jail. But that ability to take time to know the system from a perspective that's non-carceral and to work with people on an equal basis, as Jordyn says, rights-based basis, allows a different conversation to come forward. Jordyn, in your review of teams around the country, did you see this interest in resource navigation being one of the components of these teams?
What do you mean by resource navigation?
Where do I get I've got an abscessed tooth. Where do I get my tooth pulled? I haven't eaten in 3 days. Where do I get a sandwich? Where am I going to sleep tonight? Questions police don't have answers to.
Yeah. I mean, from our research, and I think William's on here too, but we definitely saw some of these programs grappling with that and follow-up services as well. But yeah, just the connection to resources seems to be a priority of several of the programs.
I think some programs are a little concerned that they're going to slip into the case management world.
Yeah.
And have to keep coming back to someone who has an infinite crisis loop. And it's not fixable. And so they just say, well, we don't know. Robert, do you have something to add?
Yeah.
You guys figured this all out, didn't you?
Well, coming from my experience working on Cahoots for a long time, that was definitely a piece of what we did, was trying to be at least aware of what a lot of the services were in the community, because we recognize, like, we have a crisis worker, we have a medic, and there's a lot of things we can do in the moment, but we can't cover all of the services that somebody might need. And so one piece of it is needing to be, like, at least aware of a lot of the common requests for services that might come up, and like, oh, okay, you need this thing, we can point you over this way, or we can give you a ride, or we can give you a bus ticket, or we can, point you out. I will say it is a large undertaking to understand the service landscape in our city. Like, people are constantly changing hours. People are losing, services are losing funding. They are gaining funding. They're doing a new pilot project. Like, it is a constantly shifting landscape, and it does take a fair amount of work to try to keep up with that. And I do recognize there is that, like, we don't want to get all the way into case management for somebody. But there's a lot of utility in the moment for being able to say, like, I'm hearing, like, what issues you're dealing with, and I have a suggestion. Like, I can point you towards, a service that will help you, that is likely to help you with that. And I can point you towards maybe I can point you towards a case management service. So I don't have to have the entire burden of, like, knowing all that stuff myself, but I know where to, like, send you, where to refer you to.
Caleb, you're in the midst of New York City. Case management is a nightmare. How does this connect with you? I mean, Eugene is conceivably possible that you could know what's going on, but New York, no.
I mean, yeah, what you were saying, Robert, definitely sounds similar, if not, on steroids. I feel like, I mean, on the one hand, there's a lot of resources, but they're also often changing. And then the sort of resources that I'm often wanting to connect people to are lacking. For such a large city, it's astounding how few respites we have, or how few available beds there are in the respites that we actually have, let alone sort of even like clubhouses. Like, why do we not have more clubhouses and respites in the city. And it seems like, across the board, there's a lot of support from people that I speak with, and then yet the resources just aren't there. So it's very frustrating going out on calls, getting to know someone, and then sort of feeling quite helpless as to what we can connect them with, or sending a lot of people to the same place that then is like, oh well, we can't, we really can't take any more people, and then you're stuck with potentially bad resources. So it's frustrating.
Other thoughts in response to Robert or Caleb? The growing complexity of peer support in mobile crisis. Well, I've asked Ruth to come in the panel to ask her question because she has a different perspective, a lived experience perspective. And I'd like also Justin to come on in and talk about the legacy of Cahoots, which he is maintaining and keeping alive. I'll just ask Ruth's question. Ruth, is Ruth in the room?
Not yet, but she's on her way.
Okay. And bring Justin in too. Well, Justin, let's hold on you for a moment and see if we can get Ruth in here. Again, if folks do have a question for the panel, put up your hand, come on in the room and ask your question. You can also put it in the chat if you want. I can read it, but prefer to have you ask your question yourself. We're all easy, safe people.
Ruth is here now.
Hey, Ruth.
Hey, can you see me now?
We can hear you. We can see you a little bit.
I don't know why it won't start, so let me see what we can do. I'm right here, so I'll just start, and hopefully the camera will catch up, but I am Navo, Dene, Yahateskoa. Anyway, I wanted to say the whole thing about calling the police, it doesn't happen in our world if we can avoid it. It's, we avoid them at all costs. So what's really important is that we work together as a group, and we've been doing that for centuries. So the idea of, calling the police at every turn or even thinking about calling the police doesn't enter our vocabulary. They've been at odds with us for centuries. And when people say things like, call the cavalry, gets us all totally bent out of shape. What's important in that is I've worked for over 40 years as a licensed psychologist, and that alone was a nightmare as a person of Navajo descent. So I decided to relinquish my license and become a peer support specialist, because that is much more in keeping with my cultural values of being actually able to help people without those silos of insanity. Because the way people are doing the best they can at any given time. Who wants to do the worst they can? They aren't. But the world from the DSM-5 never talks about where their problems came from. There's only one diagnosis in the book that talks about etiology. We need to fix that, because people come from a whole sociological background, as Caleb so amply put it. What natives have been saying for over 450 years, this whole background is why they're behaving and having the struggles they're having. And we can't deny that. And that entire book needs to be burned, in my opinion, because it just talks about diagnoses, and we can't reduce people to diagnoses, because nothing in there explains how they became the way they are. And we need to fix that. And that's why I became a peer support specialist. because we need to meet them where they are and help them every step of the way.
Well,
And so that's
Ruth,
what I wanted to say.
Ruth, hold on, stick with me for a minute. This is
Yeah.
really interesting because what you're telling me is that these, and I imagine on the Navajo reservation, every crisis imaginable is happening.
Oh, yes, we are. And my part of the reservation is very, very traditional, but we have medical crisis. We have everything. And for years, when you get a hold of the crisis people on the res, we have spiritual people who come out. We have bell ringers and what some people call shaman, which aren't even a native thing. We have medicine people of all walks that come. We have everyone available. We have our own fire brigade. We have everything available in those emergency numbers. And who do you call? You call the elders, and everyone come. And we had a ceremony just yesterday where we were doing a water ceremony, and one person was in crisis, and everything stopped. And everyone went to get her what she needs, because to us, prayer without action is not prayer.
You've heard a lot of
It's what we do.
philosophical discussion today, a lot of principle discussion.
Yeah.
What did you think of that? Do you think that that's sort
Yeah,
of
I think Caleb was saying what we've been saying for 450 years. This whole background of economy and so-called democracy is killing people. We've been saying that since people crossed what we call the Great River, the ocean. And, we were all living as kindred spirits before that hierarchy came into play. We're all related, but we all had the same issues. Go back to the Celts, go back to the Irish when they were starving to death. We've all had that intergenerational trauma, but we want to hide behind this idea of capitalism being the way out, and it's killing people. Caleb said it very eloquently.
Thank you, Ruth.
Yeah, so I will let someone else speak, but that's, our perspective is very much what Nizzy was saying. Whole different point of view. We don't call the police to solve our problems because it's never been helpful to us. That societal schema has never worked for us. So that's all I wanted to say. Thank you.
Thanks. Thanks, Ruth. Thanks for coming in. Justin, are you still with us?
Yeah, still here.
Hey, Justin, you had a comment?
Yeah, I was just saying, kind of going back a little bit in our conversation of like, how do you know where to send people? How do you know what those community resources are? Something that we get really lucky with in Cahoots is not only being the crisis response team, but also having our parent agency do a lot of those community resources. It's built in. And so something that we get so lucky for, and I know a lot of crisis teams don't have this, but something that's just wonderful is when we can self-refer, when we know what services exist and what the wait list is and what their offers are because they're a part of our agency and our organization. And so having Whitebird there as a backing is so lovely, because if we have someone that needs maybe a longer term crisis service or more in-person talk time, we're able to take them to our crisis response team as a walk-in clinic at our clinic rather than that mobile response. If someone needs those social services like a birth certificate or glasses or hooking up with Oregon Health Plan or another state, whatever their state health plan might be, we have a social services department that we can say, hey, we know on Tuesdays this is open and available. We can take you there right now. Same with medical, dental, addiction services, behavioral health services. All of those are part of our parent agency. And we're really so lucky for that. And having all of those services available also allows us to partner really well with the other community services available, like St. Vincent de Paul, like their dusk till dawn, or now it's dawn till dawn these days, safe sleep sites. It really just kind of brings that community inside. It makes it an internal referral. It makes it something that we're so familiar with that it isn't a guessing game. And for a lot of people, I know it is. And for us, in some services that we're not able to offer, it's still a guessing game. We have to kind of look up, does that service still exist this month? It existed last month. Is it still open now? There are still some things that we don't, provide or we're not able to provide, but it's just really nice having that be a built-in part of our agency and part of that crisis response model Not only do we have integrative care on our vans, we also have all of those other services backing us up with our parent agency, which is just, yeah, it's a lovely thing
It's
to
really
have.
been one of the beautiful parts about Whitebird Cahoots is it's not just this van running around town, but it's also this whole backup plan, and that the organization has done a lot of work over a long duration of time to sort of reduce the barriers. So my guess is you walk into Whitebird's front door and you say, I've got an abscess, and you don't have to become a client. They're going to say, well, the dental office is right down there.
Yeah, and it's great because our dental office does maintain like those open slots. We have more ability to do that. And as we move through kind of some changes to our budgets, our structure, all of those things, we get to learn from those opportunities of maybe this wasn't always available. I know a while ago we struggled even internally getting referrals to our medical clinic, but as we've learned from those challenges, we've had the chance to open up, okay, now we're going to have some referrals to our medical clinic and make that more available and make space for that for our crisis team. And so it's something that, again, I know we're in a unique space because we're a nonprofit that's contracted through the city and not everyone gets that space. But it really is a nice thing to be able to have those internal referrals. And it's something that even for those crisis response agencies that maybe are part of the city or part of more internal dynamics for the state, I hope that we get more programs like Whitebird that can offer those services either same day or quickly that our crisis teams in the future can refer to and have more stability in. Because one thing that I know since COVID is just every month is, does this other service still exist? Are we still able to call them? Are their hours still the same? That's always hard for everyone to keep up on. And so having that internally it really is a game changer in a lot of ways.
So being part of a community mental health system isn't the end of the world. Sometimes we have to make sacrifices. Thank you, Justin. Any questions for Justin from anybody on the panel? Anybody have any comments? Thank you, Justin. Alicia is going to join us live from Tacoma, Washington. Welcome, Alicia. Haven't seen you in a long time.
It has been a while. I had commented earlier in the discussion around what it looks like to offer support to people, and a big component of our program is utilizing like a calm curiosity, so asking questions and really being the thermostat rather than the thermometer, and trying to help people regulate in a situation that doesn't feel good. And the city of Tacoma actually built. So our program is housed within the city. We're all city employees, and they built a certified peer support specialist classification and compensation, which took a few years. However, it's finally done, and I will actually be interviewing for that position this week. So it's very exciting. So I think the work around that has been interesting, because a lot of the conversation here today has been what does a livable wage look like? And that was something that was very important to myself. And at one point I had a counterpart, and she also, so we did a lot of research around what is a livable wage, and what are the requirements that our state is asking of somebody to be a certified peer support specialist, and how do we ensure that that is matching with what we're compensating for them. And then the other component is I have lived experience. However, I am not certified as a peer support specialist. So how do I ensure that I'm connecting with resources and community to provide the best supervision that I can provide, since I'm going to be working with this person? And how do we ensure that there's clear scope of work? Because something that I've noticed in this field is that there's often a lot of additional tasks and names that get tacked onto the peer role, and that typically does not come with any additional compensation. So if I'm going to be, I have a case manager on my team, and that role is very specific. And so for me, it was very important that if I have a peer on my team, they are not doing the role of somebody else who is who is being compensated at a different rate. So it's been an interesting experience because it is a municipality that this role is being built within. So the other part of the conversation was we need people, like my goal is to hire somebody with lived experience, and that lived experience can be a variety of things. And I want to figure out how to exclude as little, like the least amount of people as possible, because that is often a part of the conversation, is who is not going to be included if we set certain expectations or have minimum qualifications or requirements. And so that was a unique conversation, and I think it turned out better than I thought. However, I also agree that this is a constant conversation of what does this body of work look like and how do we support everybody doing this work. And so I just appreciate all of the conversation today and being able to hear all of the different perspectives and experiences, because it helps me keep those things in mind, especially in the unique space of working for a city and doing that work. Because we do work with, so my program supports law enforcement and fire EMS providers. And then we also go out on our own. So we're kind of this hybrid of alternative non-police solo response, in addition to being a support to traditional first responders. So I just wanted to extend my appreciation for all of you today.
And Lisa, that's the classic Washington State model, this sort of hybrid model where you're able to shift in and out of support for law, support for fire. It's working great for Washington State. It rubs some people the wrong way, but it seems to work great.
So a lot of programs actually will either be co-response with fire or co-response with law enforcement. So we kind of tread a different line where we are supporting both, but then we also have that hybrid component of responding on our own. So we kind of spread ourselves as wide as we possibly could in figuring out how can we provide the most support that we can provide, because we know that it's needed. And how do we grow into all these various spaces? So another component of that is that my program will be becoming a behavioral health agency. So the city will hold behavioral health agency licensure.
Oh my! So you'll be able to bill Medicaid.
Mm-hmm. Yes,
you may be the first to make it.
And private insurance, also because Washington State passed legislation that if people have private insurance, then we can bill for that. However, our program is funded through the city, so regardless of ability to pay or bill insurance, whether it's private or state insurance, it will be they will be served. People will be served. So, but that's a big lift. So it's in the works.
Oh boy, I think we just made the news. Now, we didn't know about this. This is important. This is big news, Elisa. I'm going to be calling you back.
Okay. Well, thank you all very much.
Any questions for Alicia or comments about what she said? Thanks, Alicia. Thanks for joining us. People feel like they've gotten enough of this conversation? Well, it's been great to have you all. It's been a long day, especially if you're out there on the East Coast. Thanks for being with us. Thanks for putting up with our technical problems. And we'll see you tomorrow morning, 9 o'clock Pacific time for day 2. We'll be seeing a keynote by Steve Michio on day 2. We were going to have Chaku Matai. He's having some family distress and is needing to tend to that. So we're going to have Steve Michio, and Steve runs People USA out of New York State. It's the only peer, top to bottom, peer agency which has mobile crisis teams. He's got 5 of them. So I hope you come and listen to Steve. He knows a lot about this business. Thanks, everybody. We'll see you tomorrow morning.
Thank you.